Hi, Dr. Sachin.
Hi.
In our previous video, Ms. Molly, that is our clinical psychologist, had explained few topics related to cognitive behavioral basics. So the next thing that comes to my mind after cognitive behavioral therapy is DBT. So what is DBT and who are the ones who are benefited from DBT, sir? In which conditions do you use DBT?
So DBT is a type of psychotherapy which combines your cognitive behavioral approaches to understanding the rationality and irrationality of thoughts and how thought patterns are there. Along with this, there is another important concept of reality testing.
Okay.
Of what exactly am I perceiving and how much closer to reality it is. So there are both of these concepts which are integrated together to form what we call as dialectical behavior therapy. But in this, the most important point is the dialectics. So when you say dialectics, there are two sides. There are two sides to every story. Am I able to take both the sides? So that's the whole concept of it. And dialectical behavior therapy has been studied widely in borderline personality disorder, but it has also been studied and has been shown to be beneficial in populations like addictions, in people with eating disorders, in PTSD, and so on.
What are the components of DBT, sir?
Yeah, DBT has four core components. The first one is mindfulness, second one is emotional regulation, third one is distress tolerance, and fourth one is interpersonal effectiveness.
Okay. So coming to distress tolerance, many people have a confusion about tolerance and suppression. So how do you make people understand the difference between both?
So with respect to DBT, in the disorders where DBT is used, it's understood that most people struggle with tolerating distress. And when they struggle with tolerating distress, it takes one or the other form of poor distress tolerance, which can be either externalizing or internalizing. Externalizing in the form of rage, in the form of meltdown, in the form of addictions. Internalizing in the form of cutting and harming oneself, and so on. So distress tolerance is about how do you coping with distress, is about how do you not perform these and stay with the distress, right? To recruit the resources that you have within you to reach that stage where you do not either externalize or internalize in a pathological way. Whereas suppression is to find a distraction or to just, in some cases, dissociate. Where you're not fully present. Right? So those are ways in which suppression works, but that's not distress tolerance.
Okay.